our next episode, we'll be exploring tuberculosis. This disease got its name from the bacteria Mycobacterium tuberculosis, which has been causing problems since the time of the ancient Egyptians. In the past, infection from this bacteria was usually seen as an inevitable death. Because of this, physicians would give farewells to their patients, as to not lose their credibility. When infected with tuberculosis, the main organ that is affected is the lungs. This is because tuberculosis is an airborne disease. However, if it enters the bloodstream, organs like the brain, spine, liver, and kidneys become the most at risk. When it spreads to other parts of the body, it is known as extrapulmonary TB. Extrapulmonary TB is rare, but tuberculosis itself is also rare because in healthy people, the bacteria will lay dormant in the lungs. During this state, a person is said to have a latent tuberculosis infection. This is because the person's immune system is able to block the bacteria off. Those who have compromised immune systems live or work in high-risk areas, are children under 5 or are elderly, have kidney disease, diabetes, or some forms of cancer are more likely to have this dormant bacteria become active and instill a tuberculosis disease. But before we get carried away, let's get more in depth about the latent form of tuberculosis. Since the bacteria is just sitting there, you won't have any symptoms and you won't be contagious. However, there is a risk that it will become active and you will get sick because of it. So to find out if you have LTBI, you'll likely be given a skin test and a blood test. The Mantoux tuberculin skin test uses a fluid called tuberculin, which is injected into the skin causing an induration. This hard little bump will grow if you are infected with TB. The reaction of this will take 2 to 3 days to show up, so you'll need to go back to the doctor's office sometime around there to get your results back. Depending on the factor, a different size bump will yield a different answer. A normal healthy person who would not come into contact with TB normally would be considered positive at a 15 millimeter wide induration. If you have something like HIV, for example, your induration will only need to be 5 millimeters to be considered positive. The other test that you may receive is the Interferon-gamma release assay. This is a measure of how much interferon-gamma is given off by the cells. Interferon-gamma is a gene that encodes protein receptors that deal with immune response to viral and microbial life. The difference between these two tests is that the blood test is more convenient time-wise, as it only takes about a day to get results back. It is also less likely to give off a false positive. Whereas in the skin test, it's better for repeated testing. Once you have a definitive diagnosis, you will be started on a strict regimen of antibiotics. The goal of treatment for LTBI is to prevent the bacteria from becoming active. This is done by killing off the bacteria as it's in its weaker stage. First medication is isoniazid. This is the most common prescription and is usually used in high-risk patients. One downside to this medication is that it can cause severe liver damage if alcohol is taken during your treatment time. The next is rifapentine. This one can be combined with isoniazid if needed, and is usually administered to patients over the age of 12. The final medication is rifampin. There's nothing really special about this one other than just being another antibiotic that you can take. If you ignore this medication or don't know that you are infected in the first place, there is a chance that you'll begin to have symptoms of tuberculosis disease. These symptoms can show up years later as the bacteria is just waiting for your immune system to let it free. The classic symptoms of tuberculosis disease start as chest pain with a persistent cough. This cough lasts for about 3 weeks and can also be productive by bringing up sputum or blood. Other symptoms include weakness, fever, night sweats, loss of appetite, and weight loss. If you have extrapulmonary TB, you may experience spinal pain, joint damage, organ damage, or meningitis, which is an inflammation of the layers covering the brain. To be tested for TBD, the skin test and blood test will be done as well as a sputum test. In the sputum test, the mucus will be observed for Mycobacterium tuberculosis cultures. This test usually takes about a month or 2 as the bacteria need to grow. When confirmed with TBD, you'll likely receive a combination of isoniazid, rifapentine, rifampin, and possibly some extra medications like ethambutol and pyrazimide. All these medications are taken orally and may be taken while under direct observed treatment, or DOT for short. This is just so that a healthcare worker makes sure that you're taking your medications and not allowing the bacteria to live and evolve. This evolved bacteria may become resistant to isoniazid and rifampin. When this happens, the bacteria is classified as multi-drug resistant. When the bacteria becomes resistant to all or nearly all its medications, it's classified as extensively drug resistant. These both are extremely dangerous as they will complicate an already complicated procedure. As this disease progresses, your lungs will begin to fill with fluid, or in the case of extrapulmonary TB, you will have extensive organ damage. In both cases, death will soon follow. Fortunately, a vaccine is in place for tuberculosis. The bacillus vaccine is rarely given in the US and is only reserved for high-risk patients. However, this vaccine is not completely effective, so you may still get sick despite having it. In addition to that, after receiving the vaccine, the skin test will likely give you a false positive. This means that the blood test is more of a reliable source. On the bright side, tuberculosis is on the decline, but from the increasing bacterial resistance, tuberculosis may become more prevalent and just as deadly as it was before the invention of antibiotics. So, in conclusion, take your meds the way that they were prescribed. You wouldn't want to drown in your own fluid. Trust me. That's all I got for tuberculosis, so thanks for watching. I'm trying a new method of making these videos, and I'll continue to be experimenting with different methods in the future so that I can make the best videos possible. And speaking of videos, the next one will be on osteoporosis. If you haven't seen my previous video on aneurysms, I will link that down in the description. So, that's all I have for now. Until next time, stay healthy and be safe.